I am a trained obstetrician-gynecologist. For 15 years, I did both obstetrics and gynecology. My aha moment was the first time I delivered a baby. It was 3 o'clock in the morning, and I don't know that I've ever been happier. I've been seeing patients who are on the younger side, who are in their early 20s, who are looking to start taking care of themselves and taking ownership for their health. And then also women transitioning through menopause in their 40s and 50s who want to learn more about how to face the new challenges ahead. So there are a few different treatments and procedures that I offer. Routine gynecologic care, annual exams, preventive care, breast exam, pelvic exams, pap smears, contraception. And then for women who are suffering from different types of issues, for example, abnormal bleeding, abnormal pap smears, we do a lot of different minimally invasive procedures to help them as well. It's important that they know that my job is to listen, to educate, and to provide options. I believe strongly in therapeutic alliance. And so when I'm building a relationship with my patients, what I care most about is making eye contact, developing a space of calm, a space of trust. I deal with some of the most sensitive, some of the most intimate, some of the most exciting things going on in people's lives. And those stories, those relationships can't be rushed, so that by the time it does come to doing more sensitive exams or difficult parts of our evaluations, patients feel like they're in safe hands. I think there are a few different levels of the rewards that we experience as OBGYNs, where a patient leaves and tells you that she has never felt so happy or so comfortable being taken care of. When you see a patient who's really struggling through her menopausal transition and you start making these small interventions and changes, to see her back a few months later and to see her really at the peak of her game, I think is so rewarding. So I think as gynecologists, to be able to afford women the opportunity to live to their max potential is everything. I speak Spanish fluently, and I think that for me, it's allowed me to build a profound bond with patients here specifically, because there are a lot of women who don't speak fluent English and who still suffer from the same issues and need somebody who can not only relate to them, but also explain things in a way that I think makes most sense. When I'm not seeing patients in the hospital, my #1 priority has been and will always be my family.